So at EPFL we are developing wearable continuous biosensor for monitoring inflammation. And more specifically, so we are working on lactate sensors, pH sensor and C-reactive protein sensors. That could be interesting within the context of ICU. And the specific use case that we are targeting is sepsis shock. So we are developing sensors to be able to monitor those markers in a continuous fashion. Nowadays, current tests, you get data every 4, 5, 6 hours. But the patient can very quickly go into sepsis shock in our case. So if we would add more data, a better granularity in the data, physicians would be able to tell earlier if the patient will go or not under sepsis shock. So this is the main added value into doing wearable continuous sensor, is that you will have information continuously. And then this will help the physicians to take a better decision. If you have good models, may be able to help us doing like biomarker screening. So basically the VHT, if it has good simulation, can tell us which biomarkers would evolve dynamically, and then for what type of biomarkers should we develop sensors. So it's rather this heuristic way rather than we as hardware provider, we are the scaffolders. So we give inputs to the VHT to develop models. And then if the models are accurate or are good, then the models can bring us some insight about which biomarkers we need to investigate. And then we would develop the sensors on those particular biomarkers. So it's a small circle like this with a microneedle that you would really put on the arm, basically. And then all the data would be instantly sent to a phone, to an application or something like that.